right, everybody, welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and this show is for the aspiring ophthalmologist. I talk to medical students who are interested in ophthalmology. I talk to residents training in ophthalmology, and sometimes, if I'm lucky enough, I talk to current ophthalmologists in the field. Today, my guest is Dr. Rukhsana Mirza. Dr. Mirza is an associate professor of ophthalmology and medical education at Northwestern University. She got her bachelor's at Northwestern University. She then got her master's degree at Indiana University, then got her medical degree at what is now known as Rosalind Franklin Chicago Medical School, and then did her residency at Loyola University and then her fellowship at Northwestern University. She's also a leader in the AUPO and has been awarded the winner of excellence in medical student education. So Dr. Mirza, it's an honor to be with you.
Oh, thank you. Thank you for having me.
Absolutely. So, you know, a lot of us have seen you on the AUPO webinars this application season. And obviously during COVID-19, we've all been kind of lost in the transition of how to go about this process. So, you know, we're trying to get into ophthalmology, but you've been in ophthalmology for a little bit now. So tell us about your path, how you got interested in ophthalmology, and then why you chose medical retina as a subspecialty.
Sure. Yeah. So it's interesting. I have an interesting course to medical school. I actually got a master's in counseling before I went to medical school, and I worked in a psychiatric hospital doing therapy with patients who had eating disorders. And I always kind of imagined that I would become a psychiatrist or a neurologist when I went to medical school. But when I went to medical school, I realized it was pretty much during my clerkships. I did internal medicine before I did surgery. And while I was on my internal medicine rotation, I loved the thoroughness and the diagnostic aspect. And, you know, so I liked that. And, but I went to surgery and I loved the pace and I loved the kind of planning about procedures and, you know, I was like, you know, I really, really enjoy this. And while I was on surgery, I did 2 electives. I did ophthalmology and I did ENT.
Okay.
And I realized I really liked subspecialty more so. With ophthalmology, I walked in, I actually did my rotation at Cook County Hospital, which is a very historic hospital in Chicago. Right. And I walked in and there was just a feeling. And I think a lot of times, I do a lot of advising for medical students. And I really say, like, really feel how you feel in different spaces. And, I was kind of taken under the wing by that. At the time, the chairman was Alan Axelrod and the program director was Philip Dre, and they were just amazing. Yeah. So welcoming. And I love the surgeries. I love the fact that they were short. Great. And intricate and so impactful. I mean, having patients the day after, for example, cataract surgery, just be able to see, and they're so grateful and so thankful, and it's just such a wonderful feeling. And then you can almost have any type of life you want. You can be almost a primary care doctor in a sense for the eye. You can be a super subspecialist where you only deal with one part. You can work in a team like in oculoplastics with various other specialists like ENT, neurosurgery. Right. You can kind of do anything. You can do global health. You can, you know, go on mission trips, do cataract camps, just anything. And then the people just seemed really happy. So I just really kind of fell into groove when I did that. And then evaluating, kind of moving away from, you know, psychiatry, neurology, what I realized was I really wanted to know what I did every single day. And I love the fact in ophthalmology, you know, you run the list and right. these are my patients for the day. This is what I did. These are the procedures. And it was very intrinsically made me happy. I also love the long-term relationship that you can have with patients over the course of their lives. So that was my course there. And I did my residency's training in ophthalmology at Loyola. And my internship I had actually done out in California because I had matched in ophthalmology first. I knew I probably, being a Chicago native, I matched in Chicago. I thought I would probably end up in Chicago for a while, which is what I wanted to do. My family's here. So when I came to Loyola, it was a really comprehensive training, and got to see everything. I loved cataract surgery. I loved being a comprehensive ophthalmologist, but at this point, I'll kind of mention my father is also an ophthalmologist. And so I don't mention that at the beginning of my story, because then everyone kind of assumes that's the reason that I became that.
Sure.
Certainly there were influences, and I certainly think that children of physicians, they see that and they either want to be like their parents because they like what they see, or they want to do something very different because that doesn't really resonate with them. Both my parents were physicians. And so it was something that I always saw, but it was later on that I kind of connected to it. And so that's why I don't say it at the beginning of my story.
Right. Yeah. For sure.
So, I kind of talked to him a bit at that point, and I wanted to stay in Chicago, and I wanted to kind of, think about academic career. Wasn't entirely sure. And I think sometimes this is something that trainees come to. They feel as though they have to have everything planned out.
Yeah.
Their whole life planned out.
Right.
And for me, it really was a series of opportunities and a series of mentors, and just being open to that. And it really served me quite well.
Sure.
So it's an interesting story about what was happening in medical retina at the time. So at the end of my residency training was the year that anti-VEGF was coming out.
Yeah.
So there was a drug called Macugen that came out my last year of residency.
Okay.
And we were like injections. We were like, doing some injections. We have a VA hospital associated with that. I remember very clearly kind of doing the first injections, and it was kind of something very new.
Right.
But that whole world of retina really changed around that time. And so it was very exciting. Just to kind of put it into perspective, the way that the treatment of macular degeneration has changed just over the course of my career is amazing. Before the year 2000, there really wasn't any treatment other than thermal laser, which, would take your central sight from you. Not the best option, but in the long run would be better than leaving it kind of to its own devices.
Sure.
This we're talking about exudative macular degeneration. And then photodynamic therapy came out, and then anti-VEGF came out. And now, a disease that was previously thought to just be untreatable, and this is just a, bad outcome. Now suddenly you can treat it and you can maintain their sight, you can maintain their independence. And so it was my fellowship year actually that, there was a big trial, the Marina trial came out with the drug that was going to be approved for use in the eye. There was all these stories, I feel like in some way I was part of living history at that time because I was training.
Right.
And there were so many meetings, and I remember Academy was just like buzzing, and it was just so exciting.
Wow.
So I don't regret it.
Sure.
One bit. I kind of envisioned though a little bit of a different life. I thought I was going to be, cataract surgeon and do medical retina, but the way that things kind of turned out was a little bit different, just because the whole field of medical retina exploded, and I was able to really just focus on that. So I did early on in my career when I was hired on, so I trained with Lee Jampol and Alice Lyon.
Okay.
And they were amazing mentors. And I think Dr. Jampol, he really kind of got me interested in writing and doing research. And Dr. Lyon really got me interested in teaching. And so just having kind of that, those people, and even my chairman, program director at Loyola, they all kind of encouraged me. They're like, this is really a great environment for you. So I stayed on as faculty at Northwestern, and soon took over the student program.
Sure.
And so I taught at the VA as well for a while. I did do some cataract surgery with the residents, and I did that in my early part of my career, and then I just transitioned to purely medical retina, and that's what I do now. And what I realized is that transition, I think I'm probably one of the only people that you've met so far who have transitioned to not operating anymore.
That's
Because
true.
so you can do that in ophthalmology as well. It was kind of a big transition for me, deciding to not be in the OR anymore.
Right.
But the unique thing about medical retina is those things that I loved, the interventions and the outcomes, I was now able to do in clinic.
Right.
And so you can have those same kind of great moments. And, that's really kind of what it ended up really being wonderful for me, because then I was also able to focus on my education component of my academic career.
Got it.
And so that's kind of the journey.
Yeah, it's a heck of a journey, because I feel like what was something that you talked about really early on too, and that was that you were testing out a little bit of internal medicine. You kind of like that. You were testing surgery. You kind of like the pace there. And then all along, like you mentioned earlier, some of your past was in neuroscience related stuff like counseling. So it's almost like, and to me, when I look at ophthalmology, I think of it as a blend of those three boxes a little bit, like neuroscience, a little bit internal medicine and surgery. And I feel like those are three things that I personally like, and I feel like others do too. So it's
I
kind of
think one other field that I considered doing was also radiology.
oh wow.
I love imaging. And so
Sure.
if you look at actually what I do on a day-to-day basis, it
Mhm.
includes so much imaging.
Sure.
It includes all of those things. So it was really surprising when I looked at all of the different components of things that really interested me. I was
Yeah.
able to combine those together.
Right. Yeah, and there's a place for everybody, like you said, in ophthalmology, it seems like, and I think that's why the interest is so heavy in it, and it is the way the field is today. One thing that you mentioned earlier is your mentors, and obviously, like we said earlier, that you've been a big part of the AUPO. You've been awarded for how you've been educating medical students for these years, and so, what is kind of something that you've learned through the mentorship that's been handed down to you, and how you mentor others?
Well, so one mentor I haven't mentioned is our current chairman, Nicholas Volpe, and
Mhm.
he came to us about 10 years now ago. And so when he came, he is such a education focus. He's was previously a program director and a chairman. And one thing I noticed is that he that really values the development and the growth of every individual person.
Sure.
And I really kind of looked at that. And so that is one thing that I really strive to do,
Mhm.
is to really, I think that's a very rewarding aspect of being in an academic career when you're
Yeah.
teaching. So that's something that I strive to do. And I strive to be part of that. I think that one of the most fulfilling parts of my career is being part of the academic journey of people, seeing them at the very beginning, seeing
Mhm.
them go through residency, then fellowship, and
Right.
and onwards. And I've had some people graduate from residency and they're like, Dr. Mirza, it all started with you, and
Oh,
that makes me that makes me really happy,
yeah.
that I could bring ophthalmology into their lives, and that they're so happy with that. So being impactful is a cool thing.
Yeah, and with the current situation we are in right now, we're finding impact in our daily lives and in our professional lives, and how we're trying to move forward. And for applicants this year who are applying in ophthalmology, like you've been on these webinars for the AUPO, and we've been guided through you and through others about what the process is going to be like this year. Certainly, there's some anxiety. Certainly, there's some fears and some uncertainties. But would you like to touch on what you think are important tips for applicants to really focus on and to keep in mind with the perspective of what's going on this year?
Yeah, absolutely. Yeah, so those webinars really, I think, were as much for you all as they were for us,
Uh,
because we're also very apprehensive. I think for me personally, working on those helped me make kind of sense of what we were going to do and how to approach it, and coming together with all of those thought leaders, and getting everyone's opinion. I mean, it's a work in progress for everyone.
right.
But what I would say to every applicant, what I say to our applicants at Northwestern too, is that you've already begun the journey. I know that there's currently it's not what you expected,
Mm-hmm.
but sometimes that happens, right? So it doesn't take away all the things that you have done to this point. And all of us are rooting for the success of the applicants. We
Sure.
all are, we all understand that the applications are going to look differently. The interviews are going to feel different.
Mm-hmm.
And we all feel different right now.
Right.
So it's not, I know it seems like you're going through it, but we all are going through it. And, finding that fit and finding the right people, it is hard. I mean, it's hard to have a gut about, oh, I love this program by just, this is what it looks like on this screen. Right.
Mm-hmm.
Similarly for us, I think we're getting more used to talking this way.
Yeah.
But it still feels a little different.
Right.
And the feelings are very different, but I would say when you put your application together, be very thoughtful about every component of it.
Okay.
Really search into your entire academic career and say, well, what is my story? What is my journey? How am I going to make a great president? And I think sometimes people, especially in their personal statement, they'll spend a lot of time on saying why ophthalmology is so great.
Mm-hmm.
So I will tell you, we all know that it is.
Yeah,
you don't need to spend time on that.
Sure,
Of course, it's a narrative, it's a story, and that's part of it. Your part of, but I would say spend more time on how the different, how your different experiences are lend to your story, and how. And I think that, people will leave off huge chunks of things that are really important or really special about them. And it's a great opportunity there. Sure. And I think also this year there are some new functionalities, which I know that SF Match put out its own webinar. So there's an opportunity to tailor your personal statement for regional, if you have a regional preference, or if there is a certain interest in a certain program, you have an opportunity to actually put that in your application now.
Right.
And, I would utilize that, because sometimes people, looking at a pile of applications that doesn't stand out, but it can now, you know? So I would say all those things, just a real attention to even if it's something that you started, but you are able to write it and talk about it. And that's another thing. When you get to the interview, you should be able to talk about everything on your application. Well.
Sure.
That's essential. So be able to really know what you put on there. And just, again, even if you go to all of these, the tips on, being on Zoom and being on, I would listen to all of that, we just have good lighting, have good connection, be able to just be yourself, be your authentic self. I think that those are all important features this year.
Good.
But again, we all are rooting for you.
Well, we all need it and we all appreciate it. That's good to hear from the other side as well, because I feel like sometimes it's almost like we feel like maybe there's a wall, or maybe we feel like we can't reach over and ask for like, hey, are we doing this right? And it's hard to feel that way, obviously, this year. But, I think those are encouraging words to keep in mind. And hopefully to the viewers out there who are medical students like myself applying, we keep that perspective. While we're on that subject, I was just thinking about this while you were talking, and you mentioned what to do and what not to do kind of a little bit. So, you are part of Northwestern's faculty, and I'm sure you look at applications. So what are things that you look for when you look at applicants that you really like, or something that really stands out to you as your own, in your mind?
That's a good question. So I think when you go through applications year after year, there are certain things. So the way the application filled out can make it easier to read versus harder to read. So I really kind of be mindful of that. And so just applications, sometimes they're just kind of disorganized, and it's harder to read through there. So that's just a simple thing. But when I look at who the person is, besides obviously there's some certain metrics. There's schools, right? Like we all know those, and then there's schools, and then there's numbers, and then those are all things there. But you look at leadership experience, and when people talk about their leadership experience, do they just like list it, or is there like a description there? And are you able to really understand what they're doing there? And then if that is something that's so important to them, that they include that in a personal statement as far as how that impacted their journey, or how that's a part of their journey. So I think that those are just opportunities to show who you are. And then there's, when people have research, you see their publications, and you can see sometimes, people are able to present at different meetings, or they're able to, present locally, present nationally. They actually bring their research all the way to fruition to a paper. So if it is something that's important to them, those are metrics of following through, and the completion part of it, actually going through and completing their projects, and then being able to talk about them, or at least relate in an application.
Got it.
I think every program has kind of their own culture and their own, little niche, and I think that different programs are looking for different things. There's some programs that are, more community based. There's other programs that are more research based. All these programs have their own, metrics, I would say, for these are the people that kind of are successful in their program. So I think that every program is a little bit different in that way. But ultimately, all applicants to ophthalmology are very successful and highly intelligent individuals. And you ultimately want to train people who you enjoy training, and who are engaged in their learning, and who, that's why most of us are in academics. We enjoy that. Well, I would say those of us who are doing teaching in academics, that's what we enjoy, is we enjoy that engagement of the learner and being able to be a part of that.
Got it.
So,
and you mentioned culture, and Northwestern and Chicago in general for residency programs is known for the collaborative culture in Chicago, and how Loyola and Northwestern and the programs there come together on Saturday mornings and stuff for educational hours and stuff. So talk about the culture and what's something that you really enjoy about it, and what the residents enjoy about it, and just touch on that culture a little bit.
Well, there's six ophthalmology programs within Chicago, and Northwestern, Loyola, Cook County Hospital, Rush, University of Illinois at Chicago, and University of Chicago. That's all six, Don't want to leave anyone out. And they're all, the unique thing about Chicago really is that we are a close community. There's a Chicago Ophthalmologic Society, which meets, it used to meet monthly, now it's more quarterly. And it's, I think, one of the oldest ophthalmologic societies that exist. So there's a huge, that is a huge culture in Chicago ophthalmology. In addition to that, there's a yearly meeting. And then there is the Chicago curriculum of ophthalmology. And those are the Saturday meetings you're talking about. And they're actually organized by, Dr. Lyon has been organizing them for years, and they are, they span the academic year, so they're not over the summer, but faculty from all of the programs, they participate in it, and all of the residents also participate in it. So Saturday morning, everyone kind of, it's funny because I remember I've lectured at it now as an attending, but I remember going as a resident, and we all had our like little pods of this is where Loyola sat, this is where these people sat, and they've mixed it up now. So I go there, I'm like, oh, you guys are not in the same spots anymore, but so it's good that there's some mixing there, but no, it's a great, I think it's 2 hours. I forget if it's 2 or 3 hours on Saturday morning. An opportunity to hear, and I think that's also an opportunity to meet faculty from other programs. Now it's obviously COVID and a little different, but still we in Chicago, that has brought us even more together in some ways, because during the months where there was more of a shutdown, we shared even lectures with the residents, grand rounds. all those have become virtual, so
Yeah.
a lot easier to participate in others' lectures. And I know we presented on one of the webinars, learning in the era of COVID, and the Chicago collaboration was presented there. So it is a really nice group. The other thing is, as far as the retina community in Chicago, it's also very collaborative. There is the RAB study club that happens quarterly as well, and it rotates between institutions, and we bring interesting retina and uveitis cases.
Oh, wow.
Several hours in the evening, and we get together. And so it is a really collaborative community. And you know, the different hospitals are a little different. They maybe serve slightly different populations, but really good medical community here in Chicago.
Yeah, and that was something that stood out to me during that webinar was that you mentioned learning during COVID-19 is I think we're all looking for collaboration right now, and we're all trying to, it's unique in this time that we can find ways to connect with people we've never connected with before. So, you know, I think if we can carry that culture over from Chicago towards the rest of the nation right now, and across the world, it's going to be pretty impactful, and I think we're learning that. Dr. Mirza, it's been an honor to be with you. I mean, you touched on so many key issues tonight, and it's been a pleasure to get to know you these last few months through these forums, and looking forward to hopefully meeting in person someday. And we all learn from you, and we're hoping that you continue on pursuing the education of medical students and residents and fellows.
Thank you. Thank you for having me.
All righty. Take care.